Hola familia, welcome to our webinar done in conjunction with the New Jersey Department of Health. These are resources for you and your family, so they're very important to us. What's most important to a business member of the chamber? Your health. It's your most important asset, and you should always do the best to protect it. So we've teamed with New Jersey, which cares about your health, to talk about programs for you and your family. The first program is WIC, which stands for Women, Infants, and Children, and the services to support them. The second topic is harm reduction and opioid abuse and other conditions. And then the third is COVID 19, the education. So we know more about this disease. We want to strengthen the public confidence and guide residents to resources. Our first speaker will be Grace Amaechi. She's a public health consultant with the Office of the New Jersey Department of Health at the WIC division. She's a public health consultant and nutritionist with over 20 years of experience. She began her career at a local WIC agency before advancing to the state program. As a WIC nutritionalist, her role is conducting and evaluating on-site reviews of WIC operations and to ensure compliance with both state and federal procedures. Grace earned a master's in clinical nutrition from New York Chiropractic College, now known as the Northeast College of Health and Sciences, and a bachelor's degrees in food nutrition and dietetics from Montclair State University. So Grace, take it away. Tell us a little bit about the WIC program, please.
Thank you. My name is Grace. I work for the New Jersey Department of Health. What is our mission? Department of Health mission is to protect the public health and promote health communities and continue to improve the quality of healthcare in New Jersey. How do we do this? We do this by providing essential services and implementing comprehensive measures that prioritize healthcare by disease prevention and control, health promotion and education, emergency preparedness, licensing and regulations. What is public health? Public health is about ensuring that when you turn on your faucet or your tap, that you trust that the water will flow. When you walk into a restaurant, that you focus on the menu, not worrying about food safety. That when your child goes to school, you don't have to worry about them contacting polio or diphtheria or any anymore. What's when public health professionals work to stop the spread of illness, they improve health system, they educate the people on how to stay healthy. They are aiming to prevent problems instead of just treating the sick individual. Public health is all about people keeping about people, community, making sure that they're healthy and safe. It focuses on disease prevention, promoting healthy lifestyle, making sure that everyone has access to water, have access to nutritious food, and also they have access to medical care. So today I'm going to talk about my program, which is a WIC. WIC is Special Supplementary Nutrition Program for Women and Infants. This is a federal funded program that initiated to improve the nutrition of low income, pregnant, postpartum, and breastfeeding women, along with their family and children up to the age of 5. Those up to the age of 5 who are at nutritional risk. The program provides healthy food, nutrition education, referrals to healthcare services. So today we're going to discuss the legibility um, of requirements. We're going to discuss the WIC benefits. We're going to discuss all the services that WIC provide, as well as how to assess WIC within our community. So, like we mentioned before, what is WIC? WIC is the Women, Infants, and Children program that was established in 1974 to protect the health of low income women, infants, and children up to the age of 5 who are at nutritional risk. And the mission is accomplished by providing nutritious food to supplement their diets. Next slide, please. Next one. Thank you. Next, eligibility, please. Legibility. Who is legible for WIC? The second slide, please. Thank you. Legibility. For WIC applicants to be eligible to participate in the WIC program, the population group that are eligible are women who are pregnant, postpartum mothers who are up to 6 months old, breastfeeding mothers up to 1 year, infants birth to age 1, and children 1 year and up to 5 years old. There are requirements to qualify for WIC program. Those requirements include pregnant women, breastfeeding infants, children, and up to 5 years old. Also, to qualify for WIC, they will have to qualify income wise. So they have to meet the below federal poverty level of 185%. If they receive Medicaid or food stamp, SNAP, they will qualify for WIC. Also, for requirements to qualify for WIC, all applicants are required to reside in New Jersey. And also, all applicants are to qualify, they have to be determined to be nutritionally at risk by a healthcare provider or a trained health official. Next slide, please. How do they apply for WIC? To apply for WIC, they can contact the local WIC office or they can call the local clinic. We have 16 local agencies across the states. The local agencies are in North Jersey, Central Jersey, and South Jersey. The website that is showing, they can go to the DOH page. They can also look up the local agency that is closer to them. There are other ways they can also apply for WIC. Individuals can apply online using what is called the participant portal. The participant portal, the individual can sign up on the website located on the top of the participant portal. They're going to follow the direction on this website and submit their application. If the information they submitted suggests that they are eligible, the local WIC agency is going to contact them and schedule an appointment. Other ways they can apply for WIC is through what we call the third party referral provider. The third party referral provider can sign up participants through the participant portal as well. The third party referral are healthcare or behavioral health providers and agencies, community and human service agencies, education, and also health-based community organization. Those are the third-party referrals. How the third-party referral can sign up or register in 4 easy steps. The first step is to provide contact information, including their name, their phone number, and also their work email. Second, they have to select the best description of the services they provide by the program they represent. And also the third is to provide the name of the organization and their job title. And also they have to select the county where their business is located. Once the registration is completed, the WIC office is going to approve the registration and send them an email to confirmation that the account is active, and this takes 1 to 2 business days. And once that is done, they can now sign the participant through the participant portal. And once the local agency receive those information, they will contact the families directly and complete the application process. We also encourage them before they sign the participant up, they have to get permission from the family before they sign them up. Next slide, please. We provide many services. One of the services that we provide is nutrition education. We do group nutrition education, individual nutrition education. We also provide online nutrition education through njweekonline.com. So this online education, participants can sign in and complete the lessons. We also provide breastfeeding resources and support. We also that includes breast pump if needed, and we also provide breastfeeding education for mothers that need breastfeeding education and help. We also, other benefits that we provide is screening and referral to other health services such as immunization, as well as social services like SNAP, Supplemental Nutrition Assistance Program. We also provide another benefit that we provide is supplementary food. We provide nutritious food, wholesome food. This is issued on an e-week card. We promote good health and development by providing specific food that meets the nutritional needs of our participants. Typical food package that we provide include cold cereal, hot cereal, milk, cheese, yogurt, eggs, whole grains, legumes, fruits, vegetable, and juice. And also we do provide one-time farmers market, which is issued from May 1st to September 30th, and it can be redeemed up to November 30th. Those benefits can be used to purchase fresh, locally grown produce and herbs from participant farmers and farmers markets. And the benefits are accessed using the QR code that is given to each household, and the farmers can scan for payments. We also provide infant formula if it is needed. Next slide. These are important websites that can be helpful to our clients. NJ Week website, they can go to this website. There are a lot of resources that our participants can find useful. This website, they can find a place, a local agency that is closer to them. Also, week benefits, they can find a look at all the benefits, all the week benefits, how to use those week benefits, how the week, they can also find week approved stores near them. And also, healthcare providers can also find resources on this website. Like I mentioned before, the participant portal, they can be used. New applicants can use it to apply, and also the third-party providers can use this website and refer their clients to WIC. We also online education and resources. They can go to NJ Week Online, where participants can log in or guests can log in and complete nutrition education. There are also resources and links on this website, such as nutrition education materials, recipes. We have a lot of recipes on the website. We also have videos on how to prepare some of this food. And also we have important website on NJ Week Online. Next slide. Thank you.
Thank you so much, Grace. Your name is very appropriate, Grace, because people that do what you do, all of you ladies are doing great things for the New Jersey community. So I personally thank you. I know it takes a lot of compassion to do what you guys do. We're going to have questions at the end. So if you have a WIC specific question, I saw a couple pop in. We're going to hold them to the end and then address them. And up next, we're going to introduce Heather Ogden, who's a trainer and consultant at the Office of Opioid Response and Policy at the New Jersey Department of Health. She's a trainer and consultant, and she also is a woman in long-term recovery from substance use disorder and mental health issues since 2010. Early in her recovery journey, she knew that she wanted to help others find their own path to wellness and recovery. She is certified peer in both mental health and addiction, is a trained counselor, and holds a Bachelor of Art in Psychology. So somebody very passionate about what she does. So Heather, please give us some information on these programs.
Thank you so much, Carlos. Thank you, everyone. It's an honor to be here tonight. I do work as a consultant with the Opioid Response and Policy Division in the New Jersey Department of Health. I'm here tonight to tell you a little bit about our harm reduction services and our harm reduction programs. So if we can go ahead and pop the slides up, I will jump in because then I won't repeat myself. So if you can go to the next slide, thank you. All right, so I'm sure that a lot of people have heard about harm reduction. We use this phrase a lot more now than we used to, which is a wonderful thing. But as we know, there's a lot of substance use in our communities, both with our loved ones, our clients, just anywhere we go. Because remember, substance use in and of itself is not a problem. It's when people use substances and they become the problem themselves. Because sometimes it takes off, sometimes there are always extenuating circumstances, but everybody's relationship with substances is a little different. And most people know that if somebody does develop a problem, that we have resources. One of our partner divisions, Human Services, they do a lot of things with recovery. But we realize that we are not reaching people when they might need help the most. So that's why we are rolling out and expanding our harm reduction centers. So to understand why we're doing that, let's talk a little bit about harm reduction first. So what is harm reduction? We keep saying this phrase, but if we don't know what it means, it's not going to really tell you how great the services can be. So harm reduction in and of itself is just a practical set of practical strategies and ideas that will hopefully reduce negative consequences. SAMHSA, who is our federal organization that we get a lot of our guidelines from, that's how they describe it as a set of services and a type of organization, but they also say it's an approach. And that's very important because harm reduction has a very different approach philosophy than more standard traditional recovery programs, because not only is it evidence-based and client-centered, but it's also, we say in an unofficial definition, that we meet people where they are. So instead of trying to convince people to do things that they might not be ready to do, we're going to help them stay safe and give them tools and give them resources that will help them where they are right now. So the goal is to reduce health and social harms that are associated with addiction and with substance use without necessarily requiring people who are using the substances to stop them. So we know that traditional programs usually require abstinence. Harm reduction does not. Harm reduction says, we know that that whether you're plugged into services or not, this might be part of your story right now. Let's help you where you are right now. So some examples of harm reduction in everyday life, because we all practice harm reduction, we just don't use that term. Some of the things that we do in everyday life is, every day we get into our car. And I often tell people that I am of an age when I remember before we had seatbelt laws. So I remember being a small child and some of my older relatives' cars didn't even have seatbelts in them. And when they said we should start putting seatbelts on, people were not really happy about that at first. But my children, who are young adults now, would never dream of getting in a car and not putting a seatbelt on. So it became a regular practice, a common sense practice, relatively quickly. We also do things like wear helmets when we ride our bikes, or we have our kids wear helmets when they ride their bikes. Vaccines are a great example of harm reduction. Exercise and diet are a great example of harm reduction. What these things all do is harm reduction methods do not prevent bad things from happening. So wearing a seatbelt will not necessarily prevent us from getting into an accident. There's a lot of other factors that could come into play there. But what it does do is that if, God forbid, we should get in an accident, it's going to prevent us from more serious injury and hopefully prevent us from dying. So harm reduction, that is the goal of harm reduction. Harm reduction is to improve a person's life and keep them safer. Okay, it lowers their risk of serious illness or death. It's also a choice. It gives people who use substances a choice in how they want to minimize the harms that drug use might bring into their life. So it's non-judgmental, it's non-coercive. When I said the approach is very important, this is what I'm talking about. So instead of us saying, okay, here is a program and we are going to just tell you what to do, here's a list of rules and you have to follow them, the harm reduction approach is, what would you like help with and how can I help you get there? So it is also a social justice movement. You cannot talk about harm reduction without mentioning that this was born out of the communities that needed it the most. It's very grassroots based originally. Harm reduction itself comes from the early HIV/AIDS movement. Before we even had the term HIV/AIDS, we had people who lived in San Francisco who were gay and used drugs, and they noticed that some people, a lot of people, like in their little community, their friends, their loved ones, their neighbors, they were getting sick and they were dying at an alarming rate, and they weren't sure why. So they figured out that there was some kind of link, and so they started implementing their own version of harm reduction methods, and it really did save a lot of people. So the seeds of it were planted very early. It has flourished in the decades in between, and it respects the rights of people who use drugs. We recognize that people use substances and that we should not treat them any differently. They have all of the same rights as everybody else. Just because they use substances does not mean that they don't have rights. So harm reduction respects the rights of people who use drugs. Next slide, please. So we have greatly expanded our harm reduction efforts at the Department of Health. When I came on board a couple of years ago, we had 7 harm reduction centers throughout Jersey, and we refer to them as our original ones, and they all had a brick and mortar building. You could go visit there. But we also realized that there was a great need for services that could pop up within other communities. We know that not everybody can get to one of these original 7. So luckily, we were able to expand in a slow kind of rollout. And then all of a sudden, it was a very fast rollout. So we actually have 50 approved harm reduction providers throughout New Jersey, and they are a combination of brick and mortar where you can walk in. We have some mobile services. We have some that can pop up at events and right within communities. So this way, it's bringing the services directly to the people that need them. What are some of these services? Well, people who are familiar with harm reduction usually know that people can get supplies that people use to use drugs. So you can get needles, you can get all of the different pieces that go with that, because people need water, they need a place, we call them cookers, they need a place to cook the drugs in. It's sterile, basically. We want to give them sterile equipment. Not only is that safer for obviously the needle part of it, it lowers bloodborne infection rates. It also lessens people's chances of getting an infection from using a dull needle, which can also happen. But this way they have clean supplies. Most people know that harm reduction centers can supply those things. But there's a lot of other things you can get at our harm reduction centers. So there is HIV and viral hepatitis testing. There's also counseling with linkage to medical care. So if you go in for testing, you can get referred directly to the next link in the chain if you do need medical care with the results of your test. You can get condoms. You can get referral and linkage to pretty much any kind of other medical care that you might need, whether that is physical medical care, mental health medical care, social services. We can assist in connecting people with the other programs that you're listening to tonight. We can find people that are qualified and need the assistance of our other divisions in the Department of Health. if people decide that they do want to stop using drugs, if they want to go to traditional treatment, we can connect them with that. Overdose prevention is incredibly, incredibly important. And this is not just for people who are using drugs. This is for their loved ones and their family members. We give away naloxone. Some people just refer to it by the brand name of Narcan. That is the opioid overdose reversal drug. We do recommend that everybody carry naloxone because we can have the opportunity to use that to reverse an overdose anywhere. But if you have a loved one or employees, or you are in an area where, actually, it's all areas. There is no area. There is drug use everywhere. We just don't necessarily see it. So we do recommend that people carry naloxone, and our harm reduction centers will also train you in how to administer it. Safe disposal of injection equipment so people can bring their stuff back and it can be medically and safely disposed of. We have nurses in the facilities that can work with people on safer injection practices. We are noticing a lot more wounds lately. That is mostly because of what is in the drug supply. So we have been doing a lot of wound care at our harm reduction centers. We can also teach people that come in how to care for their wounds and encourage them towards more medical care for it. Some of our harm reduction centers that have brick and mortar buildings that you can actually go into, some of them are also drop-in centers. So while you are getting all of these services and talking to counselors and seeing nurses, the drop-in center part, there's snacks, there's some food, there's a phone you can use. Some of them have laundry services. That's a high need. A lot of people don't have anywhere to do their laundry while they're receiving services. Bathroom showers, and also a computer bank in a lot of them, because as we know, if you're looking for work or anything, everybody needs access to online. So we have these services that are available for clients that sign up at our harm reduction centers. Next slide, please. Okay, so obviously this is a very high level overview. Our harm reduction, we're very proud of our harm reduction centers because we have been able to expand them into so many different places. And they serve a lot of gaps in our system. I mentioned we recommend that everybody carries Narcan, naloxone. I put some references on this slide that tell you where you can get it for free. So you can go into our harm reduction centers and sign up, and you can get it there for free. If you want some other ways to do it, we have several laws in New Jersey that make it very easily accessible. You can go through, if you have insurance usually covers it, but we also have a naloxone 365 program, which any participating pharmacy, this is the link that tells you which are the participating pharmacies. You can go in there. You don't have to give away any identifying information. You don't even have to give your name. The only requirement is that you be 14 or older and it be a participating pharmacy. You can walk in, say, I need some Narcan, and they will give it to you. And usually the pharmacist will make sure that you know how to use it as well. If anybody on this call tonight is interested in finding out more about other traditional types of substance use treatment for, like if people want to go to inpatient or outpatient, in addition to or in lieu of harm reduction services, this is our statewide REACH NJ number. This is run through the Department of Human Services. And this is a 24/7 call line that a counselor will answer and will be able to navigate the person looking for services into a facility, depending on what they're looking for. They have access to know which beds are open. It cuts a lot of the work out. So I just wanted to make sure that everybody knew that was a resource. But I also wanted to mention that in this rollout and expansion of our harm reduction centers, we have recognized the need for people that speak both English and Spanish. So I wanted to make sure that you know of a few of them that do have bilingual employees currently. I can tell you that most of them are looking for more. But the Kind Collective, the Visiting Nurses Association, Hyacinth Ed, and EDGE all have bilingual employees. The New Jersey Harm Reduction Coalition and the South Jersey AIDS Alliance are also in the process of hiring people who are bilingual. So somewhere in the other slides, I believe, is a link to the landing page where you can find all of our harm reduction centers. So on our Department of Health website, you can find the listing and you'll see where these are. We have enough now that no matter where you're tuning in from, you should be able to find one without having to drive really far, which is great. That was the whole point in making sure that we had more of them in our state. If you would like to know more about harm reduction or about our harm reduction centers, or you want, you have an interest in bringing somebody in to discuss harm reduction in full, please feel free to email me. This is my email address. I will pass it on to the rest of my team members. This is, as Carlos said, this is something I'm very passionate about. As a person in recovery, I know that the best time to reach somebody is before they get to a point that everything in their life feels like it's falling apart. So if we can connect people with services earlier on, that saves a lot more lives and it gets people back on their feet. And that's our goal. We want people to live and to have lives that are worth living. So with that, thank you very much. And I will turn it back over to Carlos.
Great. Thank you so much, Heather. Again, your passion comes through, so we appreciate that. Now we're going to chat with Gaby Rodriguez, who serves as the program manager for COVID Community Core, CCC, in the Office of Minority and Multicultural Health at the New Jersey Department of Health. The program's mission is to increase public confidence and acceptance of COVID-19 vaccines in underserved communities across New Jersey by training trusted community members on the disease, on the vaccines, and updates and pathways to vaccination. In 2023, Gaby was awarded the Governor's Team of Excellence for her commitment to public service, leading by example, and helping the governor in achieving his mission to make New Jersey a fairer and stronger place to live and work. Gaby received her BS in Health Administration from Rutgers University and completed her master's in public health from Rutgers School of Public Health. Thank you for joining us, Gaby.
Thank you, Carlos.
Can we get Gaby's first slide up for her, please?
Yes, please. Thank you. Thank you so much, and good evening, everyone. My name is Gaby Rodriguez, and I'm the program manager for the COVID Community Core. I'm very excited to be here tonight and share information about our program. The COVID Community Core program started in 2021 as an emergency response to the COVID-19 pandemic under the Office of Minority and Multicultural Health. We have a team of 19 multilingual outreach workers who assist community members in navigating health systems to access COVID-19 vaccines and treatments in their neighborhoods. And we also combat linguistic obstacles and misinformation within those communities. Next slide, please. Major goals of our program are to educate community members on COVID-19 and other respiratory viruses. We also help strengthen public confidence by reducing vaccine hesitancy, and we guide residents to available resources in their communities if they decide to get vaccinated. Next slide, please. So the COVID Community Core have evolved. The program has evolved since the beginning of the pandemic to meet the changing needs of the community. From new partnerships at the local level to expanding our workforce and learning the ever-changing COVID-19 guidelines, our CCC team has always pivoted every step of the way to meet the changing needs of our New Jersey residents. Our team engages with community members by providing information regarding the importance of staying up to date with your COVID-19 and also your flu vaccines. They will help you locate a vaccine provider near you. They will help you with treatment options if you do become sick with COVID, and just overall best practices to keep you safe. As part of addressing broader community needs, our team also highlights the importance of prevention and cancer screenings. We help promote the U+2 statewide initiative that provides free cancer education and early detection, regardless of income or health insurance status. This transformation has really reflected CCC's commitment to ensuring that all community members receive accurate public health information that's tailored to their needs and to make those informed health decisions. Next slide, please. So, what is our strategy to reaching community members? Our team conducts strategic community outreach through a boots on the ground approach. For us, boots on the ground just refers to the importance of having team members physically present in minority and underserved neighborhoods to understand the communities that we work with, build relationships, and help them navigate health information. Our team focuses on two-way engagements for effective communication. This is done to ensure that our resources and educational materials meet the individual needs of community members. We focus on asking questions, having meaningful conversations with residents to build trust, and then help them make informed decisions regarding their health. Through these two-way engagements, our team is able to collect feedback to understand individual needs, guide community members to local services that can address their needs, and gain trust and build relationship with those residents. We usually we attend a lot of tabling events at static locations at FQHCs, food pantries, homeless shelters, senior centers, and we also attend local community events. Our approach of boots on the ground also allows us to canvass in high traffic areas, and we utilize educational flyers, incentives, and giveaways to get those two-way engagements started. Next slide, please. Okay, so now let me share a little bit about our team. We currently have 19 multilingual CCC members. The majority of them are, 69% are Hispanic/Latino, and we have about 38% that belong to the 45 plus age group. What makes us unique is the diversity of our workforce. This diversity really reflects the diversity of the communities that we serve. With this in mind, as you can see, 70%, almost 70% of our team are Hispanic Latino. We have found through our boots on the ground experience that community members are more comfortable speaking to someone that looks like them, who speaks their same language, someone that shares their same cultural backgrounds. Likewise, having team members in multiple age groups helps us really navigate those difficult health conversations and address their needs in their age groups. As a program manager, I strongly believe that a diverse workforce is essential in addressing cultural and linguistic barriers. I also want to highlight that our recruitment goal is to hire community members who are residents of the areas that we serve. This recruitment strategy has helped us navigate linguistic and cultural barriers since they're familiar with the neighborhoods and resources available at their local level. Next slide, please. Lastly, all of our COVID Community Corp team members have become certified community health workers. I want to share that this was an important step after the public health emergency transition to revive their outreach skills and expand their public health knowledge. This was really a significant evolution for the team from pandemic emergency mode into a community engagement focus. Through their training, our now certified community health workers have helped community members access local resources regardless of health insurance or income. They've tackled misinformation present within our communities. They've translated health information in Spanish and other relevant languages. And they've done so understanding the multiple levels of health literacy in our communities. And they really work with residents to help them understand the educational resources that we have. Our team has created a presence in a lot of the areas that we work in, engaging with community members in culturally respectful ways, addressing their health concerns with empathy and transparency. They have also provided education on preventative care and the benefits on screening to improve long-term health outcomes. And finally, our community health workers really collect some health data to understand the concerns, barriers, and medical misinformation and needs of the community to advocate for better resources and really the importance of similar outreach programs throughout New Jersey. Next slide, please. And thank you. Thank you for having me and allowing me to share the information with everyone today.
Thank you so much, Gabby. That was great. And congratulations on that award from the governor's office. We have some questions. I'm going to go in order that we received them. Some will be specific to the program, so it'll be pretty easy. Some I'll leave it up to the panelists to decide. The first one is reference to WIC. Is a single mother eligible as well? I think you're muted currently.
Yes, single mothers are eligible to receive WIC.
Excellent. There's another question. Is there any anticipation this program may lose federal funding with the current situation in Washington?
Right now, we have no information about that, so we're still serving our goal is to keep serving our participants what we are doing. So we have no information right now. So we're still serving our participants, receiving, giving them the best service that we always give them. So,
This one's for you, Heather. It's in the harm reduction. Does this include assistance for sheltering and or housing?
It does not include it directly, but it certainly is part of the connection services that our harm reduction center workers do. So they will refer you over to our shelters, depending on the area that you're in. Obviously, we have to admit that New Jersey does not have enough shelters, and we're certainly in a housing crisis. But there are other entities that we work with, and that's part of the warm handoff that our harm reduction center workers try to do. So they can certainly connect you with the resources to find people that specialize in that end of it.
Sure. This one's also for you, Heather. Harm reduction. How can you respond to the stigma that harm reducing is enabling?
Now you're in my alley. Okay. So I've been working in substance use and recovery services for over a decade now, and stigma is an ongoing issue. We have made a lot of progress, and part of it is because we are rolling out services that meet people where they are. When it comes to the word enabling, I cannot help but get very cringy every time I hear it. So I started out in advocacy, and I work with a lot of family members of loss. A lot of parents that have lost children, a lot of people that have lost their loved ones. And they told me early on that when they were accused of enabling their loved one, it was one of the most hurtful things that anybody could say to them. Because we know that when people find themselves in this position, really the only thing you're trying to enable is your loved one breathing. You're trying to keep your loved one alive. So you're not enabling their drug use. They're going to use drugs anyway. So this gives you more tools to keep them safer and hopefully keep them alive while they are doing it, and offer assistance while they're figuring out where they want to go next. So if you want some tricks and tips on how to fully address that issue, we can certainly, I have whole other trainings on it and love to talk about it. But the soundbite is the only thing you're enabling is your loved one being around. And you can tell people that. And that in and of itself is what helps alleviate stigma.
Okay, that's fair. Next question. If I have more than one child, am I getting additional support from WIC?
yes, if you have more than one child, as long as the child is between infants to 5 years old, they are all going to be getting benefits from WIC.
Okay.
That's
And this could probably be for any of you. It says, is the portal mobile friendly? We had trouble during COVID with some mobile apps. I guess some of our members don't, and some of them are using the smartphone. They're not necessarily using a tablet or a desktop. So I guess that question is based, if there isn't, maybe we could could you get back to us if there is, if the site is friendly or not, mobile friendly?
Yes, our participant portal is very friendly. You can use your smartphone
Okay.
to, if you have any problem with that, you can, with the smartphone, you can always contact the state week office, and then we can help you apply and send to the local agency.
Next question. I have been to CVS and asked for a free COVID vaccine, but they said they do not have free vaccines available and I have to pay for it. Where can I get the vaccine for free? I do not have insurance, so do I need to pay out of pocket?
I will take that one, Carlos. Well, anyone can really visit our COVID-19 hub page at www.nj.gov/health/COVID-19. We have our community calendar where COVID community calendar where there's
I think we had a little issue with her audio. So what I'm going to do is I'm going to see if we could skip to another one. Um, Bear with us, folks. We're just wrapping up some of the questions. We had a little connection issue on Gabby's line. So when she comes back, of course, they're all COVID questions now, as Murphy's Law would have. Let me see. I had some other ones written down. I guess across all these three areas, a question came in a little vague, but I guess they said, how do we address you? Can some of these things be done anonymously? I know you're checking for income, so I'm not sure if that's possible, but I guess there's a fear of privacy and embarrassment using some of these services. So is there a way to do them anonymously is the question.
Carlos, I can speak as far as the harm reduction centers are
Sure.
concerned. I know that obviously when people are going in, there's a certain amount of information that has to be collected on their end of it. But what I can tell you is this is a medical facility with nurses and we have strict HIPAA guidelines, and no one's going to know you're a client there except the other clients. And if you choose to tell anybody, especially in the substance use end of things, we guard people's privacy very, very fiercely. We understand that there's a lot of hurdles. So I can't say that things are done anonymously, but I can say that your privacy is very fiercely guarded with every level of protection that we have available.
Sure. This would have been for Gabby, but I'm hoping perhaps we could answer this one. The question is, if we want to book a COVID team, for instance, tabling, if we go to an event or location with disparity in the social vulnerability index. What I would say is Gabby's information was in the PowerPoint, which another question was if we share it, and the answer is yes, we certainly will share it. But if you could ask Gabby that question, I'm pretty sure from our pre-conversations of this event that that is something in her wheelhouse, that she would be very happy to have a team come to your event. So reach out to her to talk further about that. But I'm confident we could put you in touch, and I'm pretty sure that it's something right in the wheelhouse for that. And there's opportunities throughout the state that the agency is willing to go. So you could be in South Jersey, North Jersey, Central Jersey, and they'll reach out to you. There is a, let me see what the other, I think this is you, Heather. How does the agency make decisions on what risk to prioritize? I know you did mention that you poll the community. So I guess, is there a formal process to list them?
No, we really start with client first. So we will ask when people come in, we will ask them what it is that they are looking for assistance with. And then the plan is going to be tailored depending on what they respond to. So now I will say that we will probably encourage people to leave with Narcan, even if they didn't plan on getting it when they were coming in. But other than that, we're there to assist people in what they state as their priority, not as what we state as our priority.
Gotcha. This question's kind of for Gaby, but I think we could answer it. And I'm going to kill one of these words. It's one of those words when I see, I get nervous, but I'm a phlebotomist. Is that how you pronounce it? I'm a phlebotomist who has a mobile phlebotomy company and would love to speak with someone about offering our services of blood draw and COVID testing. So we have a member who would like to perhaps speak to somebody in procurement. Is that something that we could connect them with? Who they would reach out to? Can they start with somebody on the panel and maybe get referred to somebody in procurement?
I think that if that was sent to Gaby, that she would absolutely know directly who to send that to.
Right. So send it to Gaby. Worst scenario, send it to Danilo at the chamber. Bottom line is we're going to get it to the right people, and we'll get you in front of the people that could consider your services. Let's see. I think that was the last question. Again, multiple people have asked for the PowerPoint, so we will put it on social media. We'll send it in our newsletter. If for some reason somebody doesn't get it, again, just ask us and we will be sure to get it to you. But we're at 7:54. I want to really thank everybody, Department of Health, for giving of their time on this snowy, chilly evening. Thankfully, we're all home in a nice, warm setting, I hope. But again, thank you. These are just some of the things that the Chamber does. We love to collaborate with like-minded agencies like the Department of Health that at the end of the day are just trying to make our lives as New Jersey citizens a little bit more pleasant and keep everybody safe. So thank you to the Department of Health. Thank you to all the panelists. You did a great job. And thank you, members who are on. This will be available on both YouTube and Facebook to rewatch. Please share it with your colleagues who might be interested in it. Again, these are great services. They're all, let me ask you, Heather, they're all free, right? I mean, there's no charge for any of these that I have seen.
Correct.
So take advantage of, safeguarding your health. It's very important. As I said earlier, as a business person, it's your number one commodity that you should protect at all costs. Thank you again, and thank you, everybody, and God bless.
Thank you.